not coming to the hospital because they are afraid they're going to be not treated as well as the other people.
4 years after the death of Joyce Echaquan, an Atikamekw mother of 7 who died at a Quebec hospital north of Montreal, where just moments before her death, she live-streamed as hospital staff said derogatory and racist remarks at her. Dr. Stanley Vollant, an Innu surgeon based in Montreal, says systemic racism remains a problem in healthcare. He's the chief medical officer of the First Nations of Quebec and Labrador Health and Social Services Commission, and he says there's a lot of work left to do to make healthcare culturally safe for Indigenous people across the province, and he hopes to make changes as he's been appointed to the board of directors of Santé Quebec, the province's new crown corporation for healthcare, coming into effect in December.
Make sure with Health Santé Quebec that this framework going to be very effective, that the Indigenous people in Quebec will be safe when they are coming to consult.
We know that anti-Indigenous racism exists within the healthcare system, and this kind of put it on blast, which is tragic that a life had to be lost for us to wake up.
Quebec didn't adopt Joyce's principle, which aims to guarantee access to healthcare without discrimination. The province also refused to recognize systemic racism. In a statement to City News, Yann Lafrenière, Quebec minister responsible for relations with the First Nations and the Inuit, says, "Following this tragedy, my colleague, the Minister of Health, and I immediately took action on cultural safety, including by requesting that mandatory training on Indigenous realities be offered to all network employees. In addition, to better adapt services to the specific needs of Indigenous people, we have hired liaison officers and navigators. On systemic racism, we are combating racism in all its forms by prioritizing concrete actions while integrating the essential principles of Joyce's principle into our laws. Last year, Quebec introduced Bill 32, requiring health and social services to adopt a more safe, welcoming, and inclusive approach when interacting with Indigenous people.
Should have been constructed from the beginning with Indigenous organization.
Meanwhile, Dr. Vollant is taking part in his annual walk, a 200-kilometer journey with 20 people from Kitchi-Sakik to Pikogan, ending on September 30th, National Day for Truth and Reconciliation.
We're going to pray, we're going to walk, and we're going to share the story with people.
We honor her at this time of year, but we need to be doing the work the rest of the year too.
It looks like it's going to be very slow. But I'm sure that in a few years, Joyce, where she was, going to say, "I'm happy. I didn't die for nothing."
In Montreal, Alyssia Rubertucci, City News.